crystallizing why this normalization of the president's behavior is now making people unsafe.
Well, and
Really well done.
if somebody were doing this in real time, even not in a pandemic, if they were your child, if they
Who's
were
anyone?
your parent, if they were your grandparent, if they were a CEO at your
Exactly.
company, if they were a coworker, if they were a football coach for your children, they were a baseball, you would be worried and you would take action. And yet the Republicans just sit quietly by. Now we're up to 70,000 deaths. The president's disbanding the coronavirus task force, and he's actually pressuring governors and business owners to actually not follow his own guidelines. And now he's freaking out about an ad that Republicans did, a Baptist, a Christian who's voted Republican his entire life, Ben Howe, who helped put this ad together with some people, a bunch of Republicans concerned about how Donald Trump is handling this pandemic, and this is what's freaking him out so much. Let's play this ad that's made the president of the United States
This morning
get
in
worse.
America. Today, more than 60,000 Americans have died from a deadly virus Donald Trump ignored. With the economy in shambles, more than 26 million Americans are out of work, the worst economy in decades. Trump bailed out Wall Street, but not Main Street. This afternoon, millions of Americans will apply for unemployment, and with their savings run out, many are giving up hope. Millions worry that a loved one won't survive COVID-19. There's mourning in America, and under the leadership of Donald Trump, our country is weaker and sicker and poorer. And now, Americans are asking, if we have another 4 years like this, will there even be an America?
Paid for by the Lincoln Project, which is responsible for the content of this advertising.
Really a lot to digest there from SE Cup, and also that ad, fact check, true. Everything that I saw there, but the president is getting, we've been saying it for 3 years now, the president is getting worse.
I'd like to also point out there will be an America whenever President Trump leaves office. So that's
Yes.
an up note in that one ad. Yeah, look, I mean, yesterday we saw a president who was ready to turn the page, who realizes that this pandemic that's killed 71,000 people and infected more than 1 million Americans is getting in the way of his presidency. As he says, I created the greatest economy in the history of the country, fact check, not true, that he wants to move on. He wouldn't wear the mask. That's a signal that it's okay not to wear the mask. They're going to stop meeting for the task force. That's slowly going to go away because they feel like they've crossed the threshold. And he said out loud yesterday in an interview with ABC, there will be more death, but with or without a vaccine, it's going to pass. He says it's just going to pass. And Dr. Emanuel, we know why President Trump wants to move past this. It's hurting him politically. It's obviously cratering the economy. He thinks it's going to hurt his chance to be reelected. But when he does all these things, and when he says all these things, and when he talks about that it's going to pass, he is, of course, defying not just doctors like you, public health experts like you, but the people on his task force who are advising him. And so then it becomes up to Dr. Fauci to go and do an interview at night and politely contradict everything the president has said during the day. But obviously, yesterday really crystallized the president ready to turn the page despite the medicine, despite the public health.
Yeah, I think the real worry, certainly in the public health community, is that we're going to have wave 2, wave 3, and you're going to have a premature loosening and also an unregulated loosening of the public health measures that we've put in place. No large gatherings, physical distancing, the wearing of the mask, that have made a difference. I mean, we have a plateau. The unfortunate fact is that plateau is not really going down at a accelerated rate, which you would hope, you would expect if there weren't new infections. And you can see from the map that you put up, there are places where it's getting to be a real serious concern. Minnesota, Nebraska, part of the heartland of the president. I'm not the political brother, as I like to say, but I did study political science. Any president who had 20% unemployment, 33 million people who are out of work, we would be writing that person off. Just think of Herbert Hoover during the Depression. It was a blowout election, and I think that has to be really worrying the president a lot. On the other hand, ignoring the public health is not going to get the economy going. We have a lot of polls, and we also have a lot of empirical data on behaviors that show that people are afraid to go out because of the health concerns. And you can open up all the stores, but if people are afraid, they're not going to go to the stores. And it's hard to see how we're going to assuage people unless we have good enforcement of the public health measures. You have some therapy, preventative medication, or vaccine, and those are simply going to take time. There's no way of rushing. I mean, we're doing everything we can to rush them. Everyone keeps saying if we get a vaccine in 12 to 18 months, that's going to be record time by a lot. And yet, we have to wait that long. That doesn't mean the economy is frozen. We can do certain things, and lots of experts like me have said, let's protect the very vulnerable, those with comorbidities and the elderly, and we can slowly open up some parts of the economy. But you can't do it higgledy-piggledy. You have to do it in an organized way. And I think the president is trying to get past that.
Well, but you can't get past that. Like, you could add testing to that, vaccine clearly, but with testing, I don't know one person, especially on the science or on the political level, that says using the DPA, the Defense Production Act, to streamline testing would not help testing get to the American people faster. Everyone believes it would, and this president refuses to use all of his power to get to testing. You have to ask to Republicans, when is it not okay that he's negligent, that he doesn't do enough? When is it not okay? This move to disband the task force and reopen states comes as the virus continues to spread rampantly in parts of the country. The New York Times is out with a new piece detailing how new hotspots are countering the progress made in places like New York City, Chicago, and New Orleans. The Times made this chart showing the curve in the New York metro area compared to the rest of the country. New York is trending downward, while the rest of the country is trending upward. For example, Dallas County yesterday reported its third straight day of record cases on the same day the governor of Texas announced a new wave of openings. Salons and barbershops on Friday, gyms and manufacturing plants in less than 2 weeks. The Times notes the following: the country is still in the firm grip of a pandemic with little hope of release. For every indication of improvement in controlling the virus, new outbreaks have emerged elsewhere, leaving the nation stuck in a steady, unrelenting march of deaths and infections. Rural towns that 1 month ago were unscathed are suddenly hotspots for the virus. It is rampaging through nursing homes, meatpacking plants, and prisons, killing the medically vulnerable and poor. And new outbreaks keep emerging in grocery stores, Walmarts, or factories, an ominous harbinger of what a full reopening of the economy will bring. And here is the president yesterday discussing the sacrifices he's willing to make.